Hi, my name is Brandon Odell, and today I'm going to discuss with you the topic of free healthcare and why that should be implemented into our society. The United States of America, the place where we as people pledge our allegiance and stand for the national anthem, is flowing with immense amounts of patriotism and thrives on the idea of justice for all. We live in the greatest country in the world with freedoms like no other, yet some are denied the basic right to healthcare simply because they cannot afford to pay the medical bills. There has been major controversy on the topic of the right to free healthcare. Most people have developed their own opinions about the issue, and now I'm going to share mine with you. Many people become insolvent after receiving expensive medical bills. J.D. Chastain II, a father who is suffering from an endless amount of medical bills, shares his personal experience by stating, "My children haven't had Christmas in nearly 2 years, and some weeks we barely eat. There are holes in my roof and an entire bathroom that is unusable because I cannot afford the repairs. I haven't been able to buy underwear or socks in over a year and a half. In addition, prescription coverage is a joke. A single pharmacy that rarely fills prescriptions, and my out-of-pocket costs are now equal to an eighth of my monthly paycheck. I am drowning." There are millions of people who are struggling just like JD, yet their stories and struggles go unheard because their bank accounts cannot handle the hit. Now, I would like all of you to think about how a life would be without healthcare. Exactly, it wouldn't. Since the late 1800s, the implementation of a quality healthcare system in the U.S. has been helping and saving people's lives for decades. Providing free healthcare to all citizens could potentially save more people from becoming gravely ill or dying. Aviva Rudkin, a reporter for The New Scientist, states, "Expanding health insurance in the U.S. saves lives. In 2006, Massachusetts began requiring health insurance coverage for all residents, years before the rest of the country. Now a study shows that after the reform went into effect, the state saw a 2.9 decrease in the death rate through 2010. According to a study which was led by Benjamin Somers of Harvard School of Public Health, that translates to about 320 lives saved per year. Those who cannot afford insurance or harsh deductibles often do not seek any type of medical treatment in fear of receiving an exorbitant medical bill. This also affects individuals living in third world countries as well." Professor Adibul Hassan Rizvi states, "People in developing countries are still faced with malaria, diarrhea, tuberculosis, acute respiratory infections, HIV, AIDS, HBV, and HCV. Almost 85% of its population is denied modern medicine and surgery. Countries like Pakistan spend just 1.8% of their GDP on health. Hence, we have very poor health indicators. Some of those people could have been facing major problems that may have been prevented had they been entitled to free healthcare. The right to free healthcare would also improve public health as a whole. In most instances, individuals who cannot afford healthcare for themselves or their children go without. According to MedPage Today, Kevin MD, Howard K. Koh states, "Health insurance reform will link people to healthcare services and assure access to quality healthcare. Reform will also protect people against unfair insurance practices, so they won't be denied coverage as a result of a job loss or a pre-existing condition. If this policy was instilled in our country, we could rid ourselves of these issues. Free healthcare to all citizens will lead to a better quality system and ensure the continuity of care." The United States is a first world country, and being so, we are extremely wealthy in comparison to other countries. But what is all that wealth if we cannot provide free healthcare to all of our citizens? An article written by PwC explains, many European countries with a universal right to free healthcare, such as France, Germany, Italy, and the UK, have a lower gross domestic product per capita than the US, yet they provide a right to healthcare for all of their citizens. The United States spent $10,209 per person on healthcare in 2017, over 2.5 times the average spent by member countries of the OECD, which is the Organization for Economic Cooperation and Development. With that level of spending, the U.S. should be able to provide a right to free healthcare for everyone. When most people are in need and looking for a place to better their lives, the U.S. is almost always at the top of their list. The reason being is when people come to the States, they are looking to escape the hardships of their own countries. But how can we consider ourselves a safe haven for those who are troubled, yet not be able to help them without draining their bank accounts? There have been multiple countries who have taken on the idea of free healthcare and have created systems in order to do so. Systems that have thus far been successful. A few countries are Australia, Canada, Germany, France, Greece, Italy, Japan, Norway, Spain, and the UK. Some have adapted the Beveridge model, where healthcare is provided through tax payments, and most hospitals and clinics are owned by the government in this model, and most doctors are government employees. Another model being used is the Bismarck system. According to an article written by the North American Primary Care Research Group, the Bismarck model uses an insurance company or an insurance system, and is usually financed jointly by employers and employees through payroll deduction. Unlike with the U.S. insurance industry, the Bismarck type health insurance plans do not have a profit and must include all citizens. Countries that are using this type of model are Germany, France, Belgium, and Japan. There's also a national health model, which consists of one large nonprofit government-based healthcare system. And these ideas are practiced by countries like Canada, Taiwan, and South Korea. Over the course of my research, I have stumbled upon many stories where crippling medical debt has left people in despair. While providing free healthcare to all citizens has raised some concern, I believe that it would be more beneficial in the long run. There are still some areas that need improvement. However, providing free healthcare will help public health improve as a whole, which allows the U.S. to still be the ideal destination for those who are in need. And free healthcare would also save lives, which is the number one goal in medicine. And with that being said, I believe that implementing a universal free healthcare system would be a step in the right direction. Thank you.